know that government is actually scaling up measures to expand the COVID-19 immunization program of the Ghana Health Service to cover 20 million citizens by June this year. An earlier target set by President Akufo-Addo was revised to actually cover more persons. So far, only 16% of Ghana's population have been fully vaccinated, raising concerns over the capacity of the health service to expand the program. However, in his 28th address to the nation on the pandemic, President Akufo-Addo reiterated their commitment to meeting the targets.
To my fellow Ghanaians who have not received the jab, I urge you to take it. To those listening to the propaganda by the conspiracy theorists and those who are still skeptical about the efficacy of the vaccine, it has been a year since my wife and I got vaccinated. It has not disrupted our physical well-being. Neither has it caused us to be sick. We are, touch wood, hale and hearty, like the other 13.1 million Ghanaians who have been vaccinated. With countries in the ECOWAS community, especially in our neighboring countries, presently like us, recording very low levels of infections, and having significant numbers of our people vaccinated, and on the advice of the National COVID-19 Task Force and the health experts, I've taken the decision to revise the COVID-19 restrictions enacted under EI 64. At this point, I want to express the great gratitude of the nation to the leadership and membership of the Ghana Health Service, to all other health workers, and to members of the National COVID-19 Task Force for the outstanding work they have done in bringing us this far. Ours has been an all-inclusive national effort, including the security services, public and private sector agencies, religious and chieftaincy institutions, charitable organizations, all of whom have helped in bringing us this far. I hope I'll be forgiven if I single out the Church of Pentecost, the Catholic Church, and the COVID-19 Private Sector Fund for special praise. They all demonstrated exceptional love of country. So, from tomorrow, Monday, 28th March, the wearing of face masks is no longer mandatory. I encourage all of you, though, to continue to maintain enhanced hand hygiene practices and avoid overcrowded gatherings. All in-person activities, such as those that take place in churches, mosques, conferences, workshops, private parties and events, cinemas and theaters, may resume at full capacity as long as the audience and all participants are fully vaccinated. Hand washing and hand sanitizing points should be made available at these venues. Outdoor functions at sporting events, entertainment spots, political rallies and funerals may resume at full capacity, again, as long as all persons at those events are fully vaccinated. Government will continue to engage all religious and traditional leaders, agencies and institutions to encourage their congregants, subjects and citizens respectfully to be vaccinated to help achieve the 20 million target by June 2022. I'll also urge the media to support this campaign in full. Fellow Ghanaians, we had to impose measures to limit the importation of the virus into our country, especially as our first cases of the virus were imported through the Kotoka International Airport, KIA. Currently, the Kotoka International Airport only allows fully vaccinated passengers who are in possession of a 72-hour negative PCR test result prior to embarkation and have a negative antigen test on arrival, entry into the country. Ghanaian citizens and foreign residents in Ghana who are unvaccinated or not fully vaccinated currently are given waivers by the Ghana Health Service to allow them entry into the country through the Kotoka International Airport. They must also have a 72-hour negative PCR test result prior to embarkation, take an antigen test on arrival, and are offered vaccination. From tomorrow, Monday, 28th March, fully vaccinated travelers into Ghana will not take PCR tests from the country of embarkation to allow them entry into the country through the KIA, and will not be tested on arrival. Citizens and foreign residents in Ghana who are not fully vaccinated would, however, need to provide a negative PCR test result of not more than 48 hours. They will undergo an antigen test upon arrival at KIA and will be offered vaccination there. Ghana's foreign missions have been instructed to make vaccination a requirement for visa acquisition. It is worth noting that the establishment of the COVID-19 testing infrastructure at the Kotoka International Airport by Frontier Healthcare Services Limited at its own cost has been key to our ability to limit successfully the importation of the virus into Ghana through the airport. The efficacy of the testing regime at KIA has won global admiration and has been applauded by all those who have undergone its testing. It has been one of the reasons why Ghana was not at the receiving end of several of the travel bans imposed by the West at the height of the pandemic, for which many African countries were affected. As from tomorrow, Monday, the 28th March, all land and sea borders will be opened. Fully vaccinated travelers will be allowed entry through the land and sea borders without a negative PCR test result from the country of origin. Citizens and foreign residents in Ghana who are not fully vaccinated will have to produce a negative 48-hour PCR test result and will be offered vaccination on arrival. Fellow Ghanaians, it has been a difficult 2 years for all of us, and we're seeing light at the end of a very long tunnel. I appeal to all of you to live responsibly, protect yourselves at all times, and do everything we can to stay safe.
Well, the head of the health desk here at Joy News, Fred Smith, joins me in studio now with a breakdown of the country's vaccination drive. But first of all, Fred, welcome to the program. We need to talk about the country situation in terms of our COVID cases. What do we know so far?
Well, as we speak, the latest update is for the 24th of March, and that's what the president was referring to during his address last night. And it showed that on that day, we had 17 new cases, 10 of those from travelers, international travelers into Ghana. So it only means that we had only 7 cases in the entire country. 2 of them in Greater Accra, which has previously been the epicenter of the pandemic in Ghana. However, there's a bit of a worry for Volta region because we had 5 cases in Volta region, especially in North Tongue, where 2 cases were recorded. We have Adaklu, Anyigbe, which had 1, Whole West 1, and South Tongue also recording a case there. That brings it to 5 plus across 2, making it 7. That's the only community spread that we have in terms of our situation.
So I guess this is what's informing the reopening of the borders, for instance.
This and previous records that the Ghana Health Service has been able to put together. As we speak, we don't have any severe or critical case.
Right.
All our ventilators are free. Nobody is in need of oxygen to be able to breathe, and that kind of situation we had at the peak of the pandemic, or at any point when there's a new wave. We've had 4 before, and so it showed that we've done quite well, and that it's safe according to what the experts are advising.
But let's now talk about going forward, because it appears the president is fixated on immunizing a population of about 20 million.
22.9 million, that's right. Around 20.
So that's the target.
23 million, that's
and
the
we're
target.
supposed to do that by the end of
By the end of June, yes.
How have we done, I mean, how much have we done in the past till now? And what's the future looking like in terms of the approach being adopted?
At the start of the vaccination, we had a 20 million target to reach. Fortunately for us, we're able to include pregnant women and persons aged 15 to 18 years, and all of these persons have added to the adjusted target. So
so before, pregnant women and
15 to 18-year-olds were not part of those who were going to be vaccinated, and so we have that added to the number of persons to be vaccinated, 22.9 million persons. As we speak, 13 million, a little above 13 million, have been vaccinated as at the 21st of March, and those persons are made up of persons who are receiving a single dose or double jabs for the vaccine, and that comes down to 28.4% of the total population. However, we have 16% of the total population fully vaccinated, and we're also having some 158,000 with the booster jabs.
But then I'm also concerned about the nuances. We know that although we're talking about generally about vaccination, some have received at least a dose, some do have 2 shots, and these are the differences within the system. So clarify that for us. What's the difference between taking a double shot, and what does it mean for the national count in terms of our vaccination drive?
Well, what it only means is that we are about some 10 million doses short. We'd have to increase our vaccination for those who've taken the first jab and require, it's only Johnson & Johnson, which will give you the opportunity to take 1 jab, and that will be it. You'll be classified as a fully vaccinated person. Apart from that, we have AstraZeneca, Sputnik V, the Moderna, and Pfizer's BioNTech. All of these will require 2 jabs to be fully vaccinated. And if the opportunity is there, take a booster jab.
So the single dose is where we're hovering somewhere around 16%. Is that what's...
No. We have only 1.1 million taking Johnson & Johnson. And so that's just a small figure there, 1.1 million for Johnson & Johnson. Apart from that, the remaining are all persons who've taken types of vaccines that will require that they take a second dose. Majority of persons have not gone for the second, and it would be great that they do.
Looking at the rate at which we're going, are we able to meet that June deadline?
Well, if you want to look at how we've come, then June is too short for that target that we have.
And you're making this projection based on what has happened
before.
In the past,
but we know the Ghana Health Service is also going to intensify its advocacy for persons to get to the stage. Yesterday, we had the president explain to people that the vaccines are safe. He took it, his wife did, and they are all doing very well, and that it will be safe for all. I have vaccinated, and I believe, Blessed, you have vaccinated as well. There are no issues with us, so the vaccines are safe, and that we need to go for them.
Well, Fred Smith, I'm grateful.